quite a wide range of services actually, from consulting services and promotional activities right up front, right through to emergency evacuation services at the end. The product that sits in the middle, if you like, is assistance, medical assistance, and that's within this facility that you're talking about now. And we're providing telephonic tele-advisory services to our clients, our travellers, right across sub-Saharan Africa. That advice could extend from something as simple as a flu medication or malaria awareness, right through to a nearest healthcare provider in a particular town, through to accessing an emergency service because one actually has a significant medical problem. Duty of care encompasses quite a wide range of implications and terms, as you correctly said. Simply put, it's advising companies on how to reduce risk for their employees. So it's a risk reduction, an awareness and risk reduction strategy. And employers need to pay close attention to the environments that their employees are travelling into and travelling through, because there are implications around their health and safety that will ultimately have a consequence for the employing organisation. So legislation in each of the countries, really right across the tapestry of Africa, creates a little bit of a metaphorical minefield for organisations to operate in. And I think that's where having a strong healthcare partner is critical. So each country's got a slightly different recipe for healthcare rules and regulations. And if one's going to operate safely and correctly in each of those spaces, you need to understand the rules, and you need to be able to deliver a professional team and a professional service that operates within the context of those rules. The rules in some respect just create administrative hurdles that organisations have to jump over, and we're there to help them do that. Or the rules in a slightly more sophisticated environment are creating safety lines in the sand. They're creating a framework with which organisations can comply to appropriate standards, whether it's industry best practice, national rules, or international guidelines. Being aware of healthcare risks, you're quite right, that's not a mining company's game. They do mining. We do healthcare risk management, so it's up to us to have that helpful conversation and ensure that we walk the journey together with them. What type of risks are we talking about? Well, quite frankly, a poorly managed healthcare risk, health risk of an individual or a group of people working on a remote site or travelling, has got an impact from a financial point of view, from a reputational point of view, from a business success or business continuity point of view. And each of those areas will be affected potentially by a poorly managed healthcare situation. Let's keep it simple. Someone has a medical problem on a remote site. Could we have picked up that problem before the person went? Does the fact that that healthcare problem get managed poorly in that space compromise the company's operations? Sure. Does it impact the individual? Yes. Does it impact company morale and the morale of the workforce in terms of how well they're being looked after? Does it affect the patient outcome? Sure, it does again. Does it cost someone a lot of money? Sure, it does again. So each opportunity that we have to walk and work with the organisation to reduce that risk, at the end of the day, we should be seeing a health economic value and a health economic benefit to the company as well.